Good afternoon. How are you today?
I'm fine, thank you.
And how can I help you?
So this is my daughter Elle, and
Mhm.
she's been crying a lot lately,
Mhm.
and there's something wrong with it. I think there's something wrong with them.
Okay.
It's just stuck and just not being able to move.
Okay, I see. Can we just take a quick look at Elle's hand?
Of course.
Thank you. Okay, so now we will be examining Elle's hand. So, as you can see, the thumb is in a locked position. On feeling the base of the thumb, there is a bump here. And also, if we try to unlock the finger, as in make it straight, there is a popping sensation. So I'm not sure if you can hear it, but it's like a... How long has it been? How long have you noticed this thumb that you say is stuck?
It's been about 2-3 days.
2-3 days. Now that I've examined Elle's hand, it can be seen that she has trigger thumb. Now what trigger thumb is it's basically the thumb gets locked because the tendon has swelled up. Okay, so if you look at this diagram, it might help you visualize things a little bit better so you understand what's actually happening. You have tendons in your hand which helps to make the fingers and the thumb move. They're basically like a string inside your thumb, and this is held together by a tunnel, which is known as your ligaments. So the ligaments helps to keep the tendon next to the bone, and it allows the tendon to move the thumb back and forth in place. So when the tendon is pulled through that tunnel, the thumb bends or flexes. Now, when you have a trigger thumb, what happens is the tendon, it can't slide back and forth because you have the swelling which prevents it from moving back and forth. This means the thumb becomes locked in a bent position or a flexed position, and your child is unable to move his thumb because of this. So it's like, I mean, if you imagine you have a straw and you have a toothpick. Now, if you put the toothpick through the straw, it can slide through really easily. However, if you have, like, say for example, some blue tack and you stick it onto the toothpick, if you try to slide it through the straw, it's not as easy, it gets stuck. So like that, in the same way, your thumb, because the tendon has a bump or a nodule, like it's called, it cannot move through the tunnel of the ligament, and this causes the thumb to be in a locked position. Do you understand everything that I've explained to you regarding trigger thumb and your child's condition?
Yeah.
Do you have any questions?
No.
The reason why this trigger finger or trigger thumb occurs is unknown. Okay, so the treatment for this is initially you just wait and you watch to see if this trigger thumb goes back to normal. However, this may take months, it may take years. I can't give you a precise time for how long it can take for the thumb to be cured on its own. However, I mean, I suppose you could give it a try maybe for like 3-4 weeks. If after that you come back and it's still not cured, then you can try stretching and splinting the thumb. So what happens is you massage the child's thumb, and then you put a splint on to help keep the finger in a straight position. I think it depends. Sometimes you might need to wear the splint at all times if it's really serious, but in this case it doesn't look so serious, so I suppose if you wear it just at night time, because what happens is at night time and at morning, that's when the inflammation and the nodule, it's a little more bigger, so if you wear it at that time, it can help the swelling go down. Okay, so if the stretching and splinting of the thumb doesn't work, then we will have to resort to surgery. Now, there's not many risks to the surgery. What happens is at the base of the thumb, where the thumb meets the palm, basically the surgeon will cut through the ligament, which is the tunnel that we were talking about earlier on. And what happens is it's basically cut, and it allows the tendon to pass through, so then you can have like normal movement of the thumb. So yeah, I think if you give it a go, maybe let it rest, try some massages, and until then, if that doesn't work, we'll try the splint, and if that doesn't work, then the final result will be surgery. But there's still like quite a while until then. So with Elle's case, I think we should just wait and watch and see if it goes, since you said it was only 3 days ago. So you need to give it a few weeks, maybe 3 to 4 weeks. If it doesn't get cured, then come back and I'll suggest the splinting. And as a final resort, if that still doesn't work either, then we'll have to refer Elle to a surgeon. Do you have any questions?
You suggested some massages, so how do I do those?
Okay, so basically where the nodule is, so like on Elle's hand, it's like roughly here. What you do is you hold the thumb slightly and you try to make it straight. Try to be like really as gentle as you can, otherwise, because I know it will cause her pain. And you just like slightly massage it at the nodule so that it can help the tendon to go through the ligament, and it can allow the thumb to be straightened. Do you understand?
Yes.
Do you have any questions?
No.
Okay, that's great. Is that everything?
Yes.
Okay, well, it was nice seeing you.
Thank you.
Take care. Goodbye.
Bye.